In this video, I'm going to talk about incontinence, urinary incontinence. Incontinence is involuntary leakage of urine. There are three types of urinary incontinence. One is urge incontinence, second is stress incontinence, third is mixed incontinence. In urge incontinence, a person has a really strong urge to urinate before they go to urinate. So there are certain triggers such as opening the door when they are about to open the door, the key goes in the lock. The other triggers could be running water when they hear the sound of shower or tap water, running tap water. The third trigger is cold temperature, cold weather. So there are triggers like that. In stress incontinence, the leakage of urine happens with physical exertion, such as when a person coughs, sneezes. It can happen with jumping, exercising, sports activities. Third incontinence is mixed incontinence. Mixed incontinence is when the symptoms of both urge and stress incontinence occur together. Urinary incontinence can occur in men and women both, but it is more common in women because of the anatomy of woman's body. In women's body, the urethra is really small and it is straight. So the gravitational pull is a lot more on the urine in women's body than men's body. So there are also because of pregnancy, childbirth, menopause. During menopause, the low estrogen level can affect urethral tissue and can cause incontinence. Then our diet, bladder irritants in our diet such as alcohol, caffeine, smoking, nerve damage. A damaged nerve can send signal to bladder at wrong times or no signal at all. Excess body weight is also known to put pressure on the bladder and make incontinence worse. Certain behaviors such as using the bathroom frequently just in case, before going out, before a meeting, before a social gathering, can reduce the capacity of our bladder. So our bladder is trained to have less capacity. So our bladder is very trainable. We can train it to have more capacity, we can train it to have less capacity. Now let's discuss treatment options for urge incontinence and stress incontinence. For urge incontinence, there are three types of treatment options. One is medications, anticholinergics. Second is bladder behavior training. You see a pelvic floor physical therapist. You learn these behaviors. There's a lot of education involved. There are exercises involved that can include strengthening or relaxing of pelvic floor muscles, coordination exercises. A physical therapist can also work on the trigger points or tightness to help ease symptoms of urgency. Third option is surgery, which is usually the last option if the first two options fail. So in surgery, they put interstim implant. For stress incontinence, pelvic floor physical therapy works very well. In stress incontinence, pelvic floor muscles are mostly weak, or there could be tightness, trigger points, which can also cause stress incontinence. A pelvic floor therapist can help you with relaxing the pelvic floor muscles. They can teach you strengthening of the pelvic floor muscles, coordination exercises. For example, if you play some kind of sport and you have incontinence during that sporting activity, the coordination they can work in coordinating your activities, functional activity with relaxing and contracting your pelvic floor muscles. A physical therapist can also use modalities such as TENS and biofeedback to help ease the symptoms of urinary incontinence. Now let's talk about what is the normal frequency of urination in a day. A person without overactive bladder or incontinence normally urinates between 5 to 8 times. If you are voiding more than 8 times, you may have overactive bladder, and if you leak along with increased frequency, you may have urinary incontinence. So the first sensation of filling is when it's filled up to 100 and 250 up to 250 ml. With urgency, usually people just feel that first sensation and they go right away, and there is only just a little bit of urine, and then our just bladder just gets very used to just voiding when it's filled up to 250 ml. But we want to train it so it has more capacity, that is anywhere from 450 to 550 ml up to here. So this is the first sensation, and if we stop here and we use all those distraction techniques, behavior techniques, so we can train our bladder to have increased capacity. Research shows that it takes approximately 6 weeks to retrain the bladder to have increased capacity, so you don't have to keep going too frequently. So a pelvic floor physical therapist can help you by assessing your pelvic floor muscles and treat it as needed. So if you are dealing with the symptoms of incontinence and it is affecting your daily life, your work, your functional activities, your sports activities, there are options out there. There are medicine options, there are physical therapy options. Talk to your doctor. It is very important that you get a clearance from your doctor. If this is the first time you have incontinence, you have not talked to your doctor about it, please go and talk to your doctor about it, because you want to rule out any heart conditions, any kidney issues. If you are taking diuretics, you will have increased frequency. So medications and some other medical conditions, kidney issues, heart issues, can increase urinary frequency as well. So if you are experiencing these symptoms, whether it is urgency symptoms or stress incontinence, talk to your doctor and get a referral for a pelvic floor physical therapist. Or if you have direct access to physical therapy in your state, you can directly see a physical therapist.